Okay, this lecture will be about the ligamenta denticulata, and let me start talking about this structure. We have two longitudinal bands of pia mater that extend along each side of the spinal cord, okay? This is important to remember. Now, each band is positioned midway between the ventral and the dorsal roots of the spinal nerves. The lateral border of the ligamenta denticulata has tooth-like projections, like this here. Let me see if I still have ink here. No, this is the wrong thing. So this one. Okay, we have this here. Okay. Okay. Tooth-like projections that attach to the dura mater. So here we have the pia mater, pia mater here, and the dura mater here. Now, let me just highlight this part here. So why ligamento denticulata is so important? Because actually it will be important for anatomical structures in the spinal cord. Let's say primarily serving as a supportive ligaments that help maintain the structural integrity, which I already mentioned. The spinal cord is not just there floating, it's also attached to the to other structures, because this we have some, because this spinal cord is stable in some way. And understanding this structure here, in specific the ligament denticulata, it will help you to understand clinical applications for such as diagnosis and managing in certain neurological conditions. Now, let me just start with this part here, the lateral border of ligamento denticulata. So this is the lateral border. Let me just finish all the drawing we have here. Okay, this one, as you probably know, is the arachnoid mater. Okay, I'm gonna do all the way down here. This is a simplified version of an old neuroanatomy book that is really nice. Actually, I used to use this book during my master degree, especially during the neurological neuroanatomy and embryology, clinical neuroanatomy and embryology. Okay, and this is the dura mater. So you have the arachnoid mater and the dura mater. Okay, oops, here. And what I'm gonna do, I'm gonna use the orange one to highlight the arachnoid mater, just to distinguish from the, and separate it from the dura mater, because you can see that is the drawing. I made this drawing a small version of this. So let me just move my camera down a little more, and then okay, so this part here is the lateral border of ligamento denticulatum. Let me just use this pen here. This is the lateral border of ligamenta denticulata or ligamentum. I'm gonna write ligamentum denticulatum. Okay, so you know that now we have this structure here. The lateral border of ligamentum denticulatum. Okay. So the ligament denticulata, I mentioned, not sure if I mentioned in the beginning, but is located in either side of the spinal cord. Let me see if I can find the illustration here. Either side of the spinal cord. Okay. So back to the main illustration of this this class, and extends longitudinally from the cervical to the sacral regions. And let me just finish this part. So here, down here, and then down here. Okay, and here we have the spinal cord all the way down here. Okay, as I mentioned, and I've also mentioned the same thing in another video, is attached laterally to the dura mater via their serrated edges. Okay, and it will provide strong connection between the pia mater and the dura mater, between the deepest and the outermost layer. Okay, so let me just finish this part here. Okay, the main role of these ligaments, as I mentioned, is stabilization, okay, of the spinal cord within the vertebral canal, and prevent excessive movement or displacement of the spinal cord during flexion or other movements of the spine, rotation, extension as well. So yeah, now clinically the ligamenta denticulata can be involved in various scenarios, particularly those affecting the spinal cord or its surround structures. Let me just finish this part here. And for example, spinal cord injury, traumas such as traumatic injury to the spine, fractures or dislocations. In this kind of situation, the ligament denticulatum may be stretched or torn, and then of course you can imagine or just visualize that can lead to instability of the spinal cord, increasing the risk of secondary damage to the neural tissues. Okay, we need the spinal cord stable. Now, damage to these ligaments, can exacerbate spinal cord injuries. So keep this in mind. Other clinical conditions that might be directly related with the ligamenta denticulata, we can also add the spinal stenosis. For example, compression in conditions where the spinal stenosis, the vertebral canal will narrow, of course, due to degenerative changes, arthritis, or even herniated discs. and the ligament denticulatum in this situation may become compressed alongside the spinal cord and nerve roots. And usually the symptoms related with this condition in specific can contribute to other symptoms like a radiculopathy, which will include pain, numbness, or weakness in the limbs. Now, when talking about surgery, about this, so during surgical procedures to decompress the spinal cord or nerve roots, such as laminectomy or laminotomy, care usually it's required to take care to avoid damage the ligament denticulatum. And let me just finish this part here. Now, inflammatory conditions affecting the meninges as well, not this pen, such as meningitis, can involve the ligamenta denticulata, and while they are not directly affected, inflammation of the surrounding structures can indirectly impact their function. Formation of arachnoid cysts as well near the ligament denticulata can compress the spinal cord or nerve roots, leading to neurological deficits. Congenital anomalies as well, such as spinal bifida or tethered cord syndrome. And in congenital conditions like spinal bifida, usually abnormalities in the development of the spinal column and meninges can affect the ligamenta denticulata. And of course, this will result in structural defects or functional impairments. Now, when talking about tethered cord syndrome, in this condition, the spinal cord it will be abnormally fixed, and quite often due to the adhesions or malformations. The ligament denticulata here plays a role in tethering the cord, and it will lead to progressive neurological symptoms. Okay, so let me just finish this part. And here's the black one. Okay. Okay, just finishing this part, guys. And what else I can share? There are a few methods to diagnose this condition, and usually involves MRI, CT scans, and yeah, and usually when using imaging studies, the ligament denticulata will appear as thin, linear, and the linear structures will be running parallel to the spinal cord. So it is one of the ways that you can use to identify in images like a CT, MRI. And let me just add the orange here because this is the area of the cerebrospinal fluid, so the subarachnoid space. Yeah, basically it is what I wanted to share with you. I hope this information can help with your studies, and if you have any question, please let me know. Yeah, this is the ligamenta denticulata, and I'm gonna finish the video now. So if you can, okay, you can just follow me, share the video, and hit the like button and the ring bell for notifications. So the video will be on my YouTube channel, guys.